Hi everyone, I'm NAVEENA SELVI, daughter of THAMILSELVAN, Year 1 medical student in UMS, and my matrix number is BM24110005. Today, I would like to talk about my favorite department in medicine, which is cardiology. Before we go into the main topic, let me introduce about what is cardiology. Cardiology is a derived word from Greek where cardia means heart and logy means study or science. Cardiology is a medical specialty concerned with conditions affecting the heart and blood vessels. It encompasses various aspects including diagnosis, treatment and prevention of heart diseases. Next is significance of cardiology. Cardiology plays a pivotal role in managing diseases that are prevalent worldwide, such as heart attacks and stroke. It is vital for reducing morbidity and mortality rates. It is also essential for prevention, early detection, and effective treatment of heart-related conditions. Next, we go into our favorite part, which is anatomy of the heart. Heart structure. Heart is a muscular organ divided into four chambers, which are right atrium, right ventricle, and left ventricle. Heart includes valves that control blood flow, ensuring efficient circulation throughout the body, and is surrounded by a protective pericardium. The myocardium is the heart's muscular layer, and the pericardium is a protective sac surrounding it. Doesn't understand, right? Let me talk about more detail. The heart chamber consists of three layers from superficial to deep. First of all, endocardium. Endocardium is a thin layer consists of endothelium and subendothelial connective tissue or lining membrane of the heart that covers its valves. Second is myocardium. Myocardium is a thick helical middle layer composed of the cardiac muscle. Third one is the epicardium, which is a thin external layer consists of mesothelium formed by a visceral layer of serous pericardium. Understand, right? Next, we look into major blood vessels and valves. The heart interacts with major blood vessels including aorta, pulmonary arteries, and pulmonary veins. Blood vessels play critical roles in transporting oxygen-rich blood from the heart to body, returning deoxygenated blood for reoxygenation in the lungs. While valves ensure unidirectional blood flow and prevent backflow, maintaining efficient circulation and heart function during each cardiac cycle. Let me talk more detail about blood vessels. The aorta has two parts which called ascending aorta and descending aorta. Ascending aorta pumps oxygenated blood from the left ventricle to upper limbs and head, while the descending aorta pumps oxygenated blood from the left ventricle to lower limbs and trunk. Next is pulmonary veins. Pulmonary veins carries oxygenated blood from the lungs into the left atrium. Next is pulmonary artery. Pulmonary artery will transport deoxygenated blood from the right ventricle to the lungs, while the superior vena cava will carry deoxygenated blood from the body parts into the right atrium. Next, we look into physiology of cardiology. First of all, cardiac cycle. The cardiac cycle comprises two main phases, which are systole, where the heart contracts to pump blood, and diastole, where the heart relaxes to receive blood. This cycle ensures continuous blood circulation throughout the body, maintaining oxygen and nutrient delivery. Well, if you look into this picture, when the systole occurs, the tricuspid and the mitral valves close and pulmonary and aortic valves are open. So, the pressure in the both atrium are low and the pressure of the both ventricles are higher than the atrium. When diastole occurs, the tricuspid and mitral valves are open and the pressure in the both atria are higher than the pressure in the both ventricles. Next, SA node and AV node functionality. The SA node, located in the right atrium, initiates the heartbeat by generating electrical impulses, setting the rhythm. SA node also functions as the heart's natural pacemaker. It regulates heart rate and ensures contractions of the atria. while the AV node situated between the atria and ventricles relates the impulse and ensuring blood is pumped efficiently. Together, they coordinate cardiac rhythm. The AV node also regulates the timing of the contractions, ensuring the coordinated heart function. While we look into this picture, when the wave is the P wave, the atrial depolarization occurs, where it initiated by the SA node causes the P wave. So the next is the atrial depolarization. When complete, the impulse is delayed at the AV node. Third one is the ventricular depolarization begins at the apex, causing the QRX complex. The atrial repolarization occurs there. So the fourth one is the ventricular depolarization is complete. Ventricular repolarization begins at apex, causing the T waves. And last, ventricular repolarization is complete. Let's look into the difference between SA node and AV node. SA node is a small mass of tissue in the right atrium functioning as a pacemaker of the heart by giving rise to the electric impulse that initiate heart contractions, while the AV node is a small mass of tissue that is situated in the walls of the right atrium and passes impulse received from the SC node to the ventricles. The SC node is located in the superior lateral wall of the right atrium, close to the opening of the superior vena cava, while the AV node is located at the posterior septal wall of the right atrium, close to the opening of the coronary sinus. The SA node is longer, flattened, and episoidal, while the AV node is short and arc-oval. And the SA node generates cardiac impulses, while the AV nodes release cardiac impulses generated by SA node and intensifies them. Next, we look into mechanism of the heartbeats. Heartbeats are regulated by the conduction system, which transmits electrical signals causing muscular contractions. This mechanism involves depolarization and repolarization of the heart cells, which are cardiac cells, facilitated by ions such as sodium and potassium, crucial for maintaining a stable heartbeat. Next, we look into clinical aspects and innovations. Today, I would like to talk about my interesting cardiovascular disease, which is coronary artery disease, which is also called CAD, which is attributed to the buildup of the plaque in coronary arteries due to atherosclerosis. It leads to angina of heart attacks, posing significant health risk worldwide. Next, we look into symptoms and risk factors. The common symptoms of coronary artery disease include chest pain, shortness of breath, and fatigue. Major risk factors are high cholesterol, hypertension, smoking, and diabetes, which are all contributing to the disease progression. Next, we look into treatment and technology. Diagnosis of coronary artery disease involves advanced technologies such as electrocardiograms, echocardiograms, and coronary angiography, which helps visualize arterial blockages and assess heart function. The treatment of coronary artery disease includes lifestyle changes, medications, and innovative procedures like angioplasty, coronary artery bypass grafting, which is also called CABG, and stenting. The advancement in the heart pumps and stent designs improve outcomes for patients with complex cardiac conditions. Okay, let's look at my role models. First of all, Dr. Devi Ramasamy, who are recognized for her pioneering work in heart failure management, emphasizing patients' education. Next is Dr. Kanachin Kinliat, who specializes in the interventional cardiology, leading advancement in minimally invasive techniques. Next, look into awards and contributions of my role models. First of all, Dr. Devi Ramasamy, who has received several prestigious awards for her contribution to cardiovascular diseases, more particularly acute myocardial infarction, valvoplasty, passing, and heart failure. Next is Dr. Kanachin Kinliat, who is recognized for his role in clinical trials that enhances the efficacy of internal procedures, more particularly in the field of cardiac procedures and treating cardiac conditions. In conclusion, cardiology is a dynamic field continually evolving with technological innovations, improving patients' outcome and understanding of heart diseases. That's all from me. Thank you.